Intermittent explosive disorder, commonly known as IED, is a mental health condition that is characterized by recurrent, sudden episode of impulsive, aggressive, violent behavior or angry verbal outbursts that are grossly out of proportion to the situation, not meditated and not explained by any other mental or medical condition. It is a condition in which the person is having a recurrent episode of outburst of anger, impulsive lack of control, and a kind of aggressive behavior that may even lead to violence, destruction of properties, self-harm, and others, which is usually followed by a period of regret and a period of remorse. The major symptoms of these conditions include the recurrent behavioral outburst, which is representing failure of the person to control his emotion, to control his anger, or the failure of that particular person to calm himself in stressful situations. This behavioral outburst or this outburst may be behavioral aggression, which may be presented in temper tantrum, verbal fights and threats, that somebody will be saying words that are inappropriate simply because he is angry and cannot control his anger. Or it can be a physical aggression whereby the person may be attempting or even harming himself or harming others or destroying properties, breaking glasses, breaking utensils, destroying things just to show that he is having anger that he cannot be able to control. And when you look at the way the person is responding, the aggression is highly unproportional to the situation. That is to say that the trigger, the stimuli, the situation is small, but the kind of aggression the person is showing is excessively high. It is more than the normal expression that a normal person is supposed to give to any triggering situation of such nature. This aggression is usually unplanned. It's not something that can be predicted. It comes as a sudden, acute something that the person just he cannot be able to control it. It overtakes the person's will. It is out of, or it is not done for any gain of money, recognition, or anything. In fact, it is something that the patient himself or the person being affected himself cannot be able to control. The pattern and frequency of this behavior varies among individuals that are affected. Some people may have it twice in a week. They may have that kind of episode of outburst of behavior twice in a week, or it may be even 3 times in a month, or after 3 months, or after 6 months, some not more than 3 times in a year. So the severity depends on individual. One thing about people with this kind of disorder is that immediately after the disorder, after the manifestation of the symptoms, they usually get relief. And after that relief, everything now comes down, goes back to normal, and they feel a kind of guilt and a kind of remorseful response. They feel embarrassed. They are not happy. They may even be crying. Why did they react such a way to a situation which is supposed not to be reacted in that manner? So usually they don't like it. It is not intentional. It is something that is overwhelming them, that is taking their control, and they don't like it. Usually after the episode, they feel remorseful. They feel very regretting. They will be regretting what they have done during the episode. People who are having this kind of behavior may be of different age category. It may start from early childhood, from childhood to early adolescent, and also it is more common among men than in women. But it is also there in women, but more common among males than in females, or men than in women. Part of the challenges faced by people with this disorder is that they find it difficult to live peacefully with people, because people will be looking at them as some people that are abnormal, of course, that they always don't like any situation that will trigger them, and they will be looking at them as people who cannot adjust, adopt, and adapt, that these are people, in fact, their social relationship will be affected, sometimes even financial, or it can even lead to some legal implications. For example, when the person during the course of that episodic outburst of behavior, uncontrollable behavior in the destruction of property. Someone may destroy property that do not belong to him. Someone may wound himself or wound others. Someone can take something and throw, like something like knife or glasses, and throw it at someone, because the person will be shouting, screaming, and that can lead to legal consequences apart from the physical and mental as well as social consequences that it has. That is what you call intermittent explosive disorder.